Hello, everyone. My name is Steve Feinstein. I'm a clinical psychologist by training. And with Oshi Health, I am a gut brain specialist. And that's what I do in my daily practice. I think Heather thought she might have misspoke, I think, when she was talking about kind of the impact of digestive health on GI, or maybe the impact of GI on stress and vice versa, right? Back and forth. I think that really is part of our talk today. It's about the interconnectedness between the brain and the gut and about how stress impacts digestive health, and then in turn, how digestive health also impacts our stress and how all this stuff is connected. So I think that was a good misspeak if, that's how we're going to talk about this. I'm very excited to share today, not only about how this connection between stress and GI exists, but also actually kind of what is going on in the body, in the nervous system, how that impacts your gut, and then also some specific evidence-based tools of what to do about it, how to treat it. So I hope you're ready for all that today. And as Heather mentioned, I got the questions that I'll try to speak to afterwards. And I hope that as we go along, usually for me, this is kind of a dialogue that I have with the patients, that I meet with. But today it's going to be a talk. But hopefully you guys will add some questions, anything that would come up that doesn't make sense or you want clarified, so I can speak to that at the end also. All right. Next slide, please. So starting out with the foundations of this gut-brain connection, just wanted to talk about how like um, common persistent GI symptoms are in the general population. And a lot of surveys have looked at this. Up to about 40% of people report that they experience at least one kind of chronic GI symptom. So if this is something that's happening to you, you are in good company. This is a really common occurrence. Some of the most common symptoms that are reported are in about 25% of the population, bloating, and about 20% abdominal pain and 20% heartburn. So this is something that is quite common. And again, if this is happening to you or someone you care about, it may not be something that we talk about in general conversation too much, but it is something that is absolutely going on and a very common occurrence. Next slide, please. So let's talk about what does stress feel like in the gut. Make some of these kind of common connections that most people recognize. For example, something may occur or there's a situation that comes up and we get this sensation, as you can see from this picture, of kind of what feels like butterflies in your stomach. We have all kinds of terms like I feel like there's a knot in my stomach or a lump in my throat. Or even sometimes we feel like we get certain information or somebody says something, it almost feels like we just got a punch in the gut. Um, Another thing that I think a lot of people realize is we get this gut feeling. We have this language like trust your gut, right? We might be speaking to somebody and all of a sudden we get the sense that, oh, I thought they were being nice, but maybe, oh, it sounds like they're trying to sell me something, right? You kind of trust your gut about people's intentions. So it does seem like most of us in a lot of experience in our life, just we recognize somehow that the gut and the brain are connected, that there's something going on here. And I think as human experience, we just recognize that. Other things, of course, to mention are, kind of symptoms that commonly come along with stress. We'll talk more about nausea, of course, bloating, heartburn, abdominal pain. Sometimes there can be stresses that come up and we'll have this sudden urge to go to the bathroom, this urgency, or kind of this what we've called kind of stress diarrhea. All these things are very common. And I think they begin to have us recognize these physical reactions driven by the gut brain axis that we're going to talk about here more today. Next slide. So, what does this look like in the GI tract? This is when I talked about this interconnection between stress and GI, and that it goes both ways. One way we can talk about this is we often notice that we might have some kind of gut disruption that begins, some kind of symptoms. We may not know where it's coming from, or we might. We might know this is from an illness or inflammation or infection or disease. And this can often lead to discomfort, irregular bowels, and a lot of other discomforts. What we know, though, is that that actually leads to a shift in brain chemistry. So the gut actually produces serotonin, the vast majority of it, which is a what's called a it's a neuromodulator. It's a substance that actually helps to regulate our mood, regulate our emotional state is one way that we feel it. And the amount of serotonin in our gut and what is going on there can have an effect on the amount of serotonin, this neurotransmitter in our brain. And that can affect our brain chemistry, which then affects our emotions. So this idea of this emotional reactivity increases. We'll get a change in hormone levels, disruption in digestion. This can lead to then what we kind of give names to, like anxiety, irritability, this emotional sensitivity. So that's one way that gut disruption can seem like it's the beginning part, which leads to a change in brain chemistry and a change in our emotions. But like I said before, we also have a lot more evidence now over the last several years that it can go the other way. We could have what appears truthfully to be a beginning of some emotional reactivity changes, as we might call kind of emotional changes, more anxiety and stress. That could then go the other way, leading to shifts in our gut regulation and can lead directly to an increase in GI symptoms. So we have like this circular kind of vicious loop between our gut and our emotional or our brain. And we're going to talk about exactly what that looks like. I'm going to take it out of the abstract and make it a very kind of concrete picture here in a little bit. We just wanted to talk about all these connections between GI and emotional changes. Okay, next slide, please. Before we go into that, I want to talk about a little bit of different types of behavioral health. Kind of understanding, I describe myself as a clinical psychologist, but in my day-to-day, I'm a gut brain specialist. Let me talk about what that is. Um, there's a lot of behavioral health providers out there, and just to kind of help clarify kind of what I do, if you look in that middle line, we have behavioral health provider. This is kind of a bit of a general term used for kind of a licensed mental health provider, right? It can be a PhD like I have. It can be a licensed clinical social worker or a counselor. That's what we call kind of therapy. This is usually talk therapy is what we're talking about here, mental health support using different therapies. The context here is kind of supporting reduction, people who are dealing with anxiety, depression, and all kinds of adjustments. A clinical health psychologist is a licensed psychologist who is trained in specific health behaviors and chronic illness. And that's what I had done for many years prior to joining Oshi. This is a behavioral health provider that specifically specializes in health and chronic health and looks at some of those physical manifestations of psychological issues. But a lot of times, clinical health psychologists will do some of their work, as I did, with GI conditions, working with people with IBS or irritable bowel syndrome or inflammatory bowel disease and other types of illnesses with GI. So now that comes to the gut brain specialist, which is I do every day. And it is a little bit different. We really focus very specifically on GI symptom reduction. We specialize in what are called brain gut behavioral therapies. And I'm going to talk about those as we go on, exactly what those are. And we treat really primarily conditions like irritable bowel syndrome, along with many others. Next slide, please. One more thing just to clarify this kind of gut therapy versus traditional therapy. And what you get with the gut brain therapy at Oshi is you're going to get, of course, a focus on GI health. We are licensed providers. We focus on GI symptoms. We usually provide a pretty brief treatment process. Like on average, we might meet with members about 3 times. So as you can see, this is a little bit different than a traditional talk therapy, which can often be kind of on an ongoing basis, focusing on mental health, improving well-being. Our treatment is very specifically focused on GI symptoms, on the nervous system, how that disrupts our gut, and the techniques we want to use to improve it. So it looks a lot different than traditional therapy, a lot of times what we do. But of course, all of us have a background in behavioral health, and we can speak to how some of those emotional experiences and GI experiences are connected. Next slide, please. So now we're going to talk about specifically how stress impacts the GI system. Let's go to the next slide. So This is a slide that describes the gut-brain connection. And this is really the basis for our treatment. And what I'd like to do is I'd like to take a deeper dive into this. There's a lot of information on this slide. I'd kind of like to do this in a way to describe the gut-brain connection, describe the nervous system and how it functions. You can see over here on the left, we have central nervous system, enteric nervous system, vagus nerve. I want to connect all those things together and give you a little bit of dialogue. This would be kind of like the intervention that I would do with in kind of the first appointment that we have with our patients. So I want to give you some real specific kind of structural things that occur in our nervous system that affect our gut. So let me start with this idea of the nervous system. The nervous system, which is the part of us that really controls it all in the human, right? And it is the hub of this nervous system is very specifically the 75 billion neurons in our head. We call that the brain, obviously. That is what controls everything. It controls all of our experiences, our senses, right? It controls everything that we see and hear and feel. It also controls all of our thoughts, all of our emotions. This is where everything comes together, kind of creates that human experience. But our nervous system is more than just our brain. It goes throughout our entire body. And I want to talk about one part of the nervous system that is outside of the brain. That's a really particular important part for digestion. And that part is actually called the enteric nervous system. The enteric nervous system is the second largest part of our nervous system and the largest part of our nervous system outside of our brain. And it is literally in our gut. So, in the lining of our abdominal wall, from the beginning to the end, we have about 500 million neurons. We call this the enteric nervous system. That enteric nervous system is the part of our nervous system that is primarily responsible for digestion. Digestion is a really complicated process. And, there's many steps to digestion. It doesn't just happen by accident. It is actually regulated very closely by our nervous system. So our nervous system does everything when it comes to digestion. Um, and the enteric nervous system itself is not only a large part of our nervous system, but it's actually I'd say a very advanced part of our nervous system outside of the brain. I believe it's the only part of the nervous system outside of our brain that we know that can do kind of independent regulation of functions, which is not normal. Most of our nervous system outside of our brain or every other part really is totally dependent on the brain for everything. But the enteric nervous system in our gut can do a lot of the digestive process without much assistance. Um, so this is a very large part of our nervous system and an advanced one. And for that reason, sometimes it's even called, kind of gets the name the second brain. But let's talk about this for a minute. The enteric nervous system can do a lot of digestion, but it doesn't do it all by itself. Every part of our nervous system is connected to the brain. And as it turns out, the brain, specifically our brain stem, so the back part of our brain, is also very involved in the digestive process. So this nervous system in our gut that you just found out maybe that you have, and our brain are communicating. And they communicate, as you can see in this picture here, the vagus nerve is the literal cord that connects the enteric nervous system in our gut to our brainstem. As it turns out, we know now from research over the last couple of decades that it's very important for the vagus nerve, of course, connecting the brain and the gut. Communication over the vagus nerve needs to be pretty consistent and regular for us to have good digestive process. The way that the brain and the gut communicate through the vagus nerve is they actually send electrical signals. That's how we work. Neurons fire off in our gut, literally sending an electrical charge over the vagus nerve to the brainstem, and we get all kinds of gut sensations, whether that be nausea or pain, or kind of a feeling of sensation of fullness or hunger. All of those sensations are because the vagus nerve is connecting literally and physically the nervous system in our gut and our brain. And it's this vagus nerve that provides like a highway of information between the two. We know that not only signaling goes from the brain to the gut to tell the brain what's going on in the gut, but we also know that the brain sends information back through the vagus nerve back to the enteric nervous system to help the digestive process. So the nervous system in our gut and our brain are communicating through the vagus nerve and have to on a fairly consistent basis for digestion to go well. So that's an important part of how we are structured. I hope this gives you a more concrete kind of picture of this nervous system in our gut and our brain, how they're connected. They need to communicate for digestion to go well. So that's the first part of the structure of how the brain and the gut literally are connected physically. Now let's go to the next slide. Here's the other part of the story that leads to how our brain and our gut can get dysregulated, disconnected. And this is a really important natural part of how we function. Let's talk about two nervous system states. The first nervous system state I'm going to call, it's called the parasympathetic nervous system. We also call it rest and digest. We can recognize this state by generally how we feel. Do we feel calm? Do we feel kind of grounded? Kind of at balance, low stress. We feel pretty safe. We don't feel threatened. That's our rest and digest. During that nervous system state, digestion is really a top priority. So the brain and the gut are communicating nearly constantly through the vagus nerve again, sharing information on what's going on in the gut. The brain is sending motor responses back to the gut to help regulate, speed things up, slow things down, help the gut and the nervous system there to create our best digestive process. So that is the parasympathetic rest and digest nervous system, which we now know we need to be in pretty consistently for our gut to be well regulated. But we have another part of the nervous system. We call it the sympathetic nervous system. We call it the fight or flight, sometimes the fight, flight, and freeze response. I'm guessing that most of us have heard of that, and we know what that feels like. That is our survival nervous system. That is a crucial part of who we are. That has kept our ancestors alive and possibly us, right, for a long time. This is a crucial part of the way that we work. We need to be able to respond quickly to a threat. And kind of a mindset shift here. Human beings, for a few 100,000 years at least, dealt with the world in a way that we were never the biggest and baddest animal out there. We had to be aware of what was around us. We had to be careful. We had to be always on top of our environment. And this fight or flight nervous system was a way that we survived. For example, when there's a certain amount of perceived threat in our life, our nervous system will change. It's a natural survival instinct. What happens is, for example, a physiological change will occur, such as adrenaline is pumped into our bloodstream, our heart rate goes up, our blood pressure goes up, right? We have muscle tension increase. And a lot of times we notice our breathing even changes. It gets more quick and shallow. We get hormone changes like cortisol released into our bloodstream to take action. All of that massive physiological change, again, is produced for the one reason to make us the best running and fighting humans possible so that we can survive. Again, this is a crucially important part of our nervous system. It's what we call stress. It's what we call anxiety. We give it names like panic, right? Just kind of high stress situations. This is what is going on in our bodies during that time. Now, the most crucial connection. When we go into that fight or flight state, something else happens between our nervous system and brain and gut that's crucial to our digestion. All of that communication that was traveling through the vagus nerve back and forth between the enteric nervous system and the brain is basically going to be ignored or disconnected. The brain during that fight or flight response is not going to pay any attention or spend any time or energy on regulating the gut. It is going to be off saving our lives. Natural effect of that. And I think to make this clear, this is not broken, but the natural effect will be that our brain and our gut will be disconnected for a time. If that happens for a few minutes, that's pretty normal. We might feel something. A lot of us can kind of have a gut response and we feel that response. But what occurs and can cause even more problems is when that fight or flight response and when we experience chronic stress. And I'll talk about that in a minute. But during that condition, we just get more and more brain gut disconnects because we go into this fight or flight state. Our enteric nervous system in our gut can do a lot of things by itself and it's crushing away doing digestion, but it needs the brain's coordination and connection and help. And when the brain is off saving our lives and doesn't pay attention, our gut just gets more and more dysregulated. This is literally kind of that physical connection. And then the disconnect when we start to feel our gut in a reaction to stressors going on around us. It's a natural nervous system reaction that is purpose built. It's not broken, but it becomes really problematic for our gut when it happens on a consistent basis, leaving us dysregulated and leaving our system, leaving our symptoms in a really bad space. Next slide, please. So I hope all that made sense. Usually I can get some feedback, and I hope that you guys ask questions. What I wanted to do is paint a really clear kind of physical picture of that brain gut connection, not just talk about it in an abstract, which is kind of what we hear, but say like, hey, there's a nervous system in our gut called the enteric. We have our brain, right? They're connected by this longest cranial nerve called the vagus nerve. We know that that's crucial to our brain and our gut being able to communicate because our brain and our gut need to communicate to do this really complicated digestive process. The gut can go it alone for a while, like when we get into that fight or flight state. But if we're in that stress state for too long, then we get a lot of disruption. And that disruption can actually be a major contributing factor to our GI symptoms, or at least it could really amplify some of the symptoms that we already have. Now I want to go to the idea of different types of stress, because I think this will explain a little bit more of our experience on a level here. I'd like to start with acute stress. Acute stress, I think we can recognize as being something where an incident comes up and then it resolves fairly quickly. Maybe we have something that goes on at work, something that doesn't go well with a project, and we have to talk with our boss, our team, our superiors, and try to figure out what went wrong. And this situation comes up. Maybe it goes on for minutes or hours. We figure something out, we come to some resolution, and we move forward. I think that's what we call more kind of acute stress. We can feel a lot of times some sensations in our gut. We might get some cramping. We might even have a little urgency, some temporary bloating. A lot of things can occur. But once that stress is gone, usually our gut comes back down to baseline and recovers pretty quickly. There's another type of stress that I think talks to the idea of an acute stressor that has a particular endpoint. So I wanted to mention that too, because a lot of patients talk with me about this experience. They have a big project at work that maybe it lasts for several weeks. It's an important project and there's a lot of things to go on with it. It takes a lot of energy. Maybe it's a lot of travel. It's a lot of disruption to life. And we usually just crush through it. We're able to kind of not have too much GI distress during it. We're kind of in that survival mode. Our body knows what to do. It takes care of us. We take the energy we need to get this project done. But what also happens at the end of those times, a lot of times, maybe not right after the project is complete, but maybe even 24 hours or a little bit after that, we'll get kind of this rebound in symptoms. And a lot of people talk about, I had a stress, but the stress is now gone. So it's hard to find that connection. But what we often find is during that stressor, the brain and the gut were disconnected for quite a bit of time. Everything was going as needed. We were doing everything we can. We had to get through this. But then when the brain and the gut reconnect after all that time, there's a lot of dysregulation that had taken place. And it's almost like a rebound effect. We get a rush and change in hormones. We get this brain gut reconnect, and we get a lot of symptoms that can come on, not long after the stress, that prolonged stress had kind of resolved. So that's another really common experience that makes it sometimes hard for us to really kind of understand how could that kind of stress that I felt fine during now be leading to this really challenging symptoms after. The third type of stress I want to talk about is the one, though, that I think has the most lasting impact and is the one that I think we probably have the most treatments for. And this is chronic stress, and it's different. Um, these are probably stressors that maybe you have little or no control of the outcome, right? But we have to deal with the daily consequences. I think, this could be a lot of times. I was just actually speaking to a patient recently who had the death of an adult child. That was a situation, of course, that there was no control over. It was creating a lot of lasting impact on his family and his son's family, right? There can be a lot of other chronic stressors. Maybe it's financial, it's relationship. We know in this day and age that we run into these kind of chronic stresses. And if we think back to the brain gut model, when we have a chronic stress, every time that stress gets a bit elevated, we'll get this disconnect between our brain and our gut. And when we get that disconnect between our brain and our gut, that'll just mean more dysregulation and more dysregulation. And if the stress goes on for weeks, months, years, or longer, the next thing happens. The basically the environment of the gut becomes chronically disrupted. That chronic disruption then in the gut becomes like the normal gut state. Okay. So when that becomes the normal gut state, even if or when that chronic stress lessens, our gut just stays in that new chronically disrupted state for a long time unless we specifically target it with some treatments and some gut brain therapies. So I see this with a lot of members. This happens a lot when it comes to IBS, irritable bowel syndrome. Um, it's a very common thing to occur, and it's kind of hard to understand how that regulation over time just changed our gut. One of the particular ways it actually changes our gut is it actually changes the sensitivity of the neurons in our gut. In that enteric nervous system, there are about 500 million neurons, and they're looking for trouble. And if we have a lot of dysregulation over time, those neurons become very sensitive, like hypersensitive. And one thing that's very common is we can end up starting to basically have our neurons firing off and signaling pain even when the disruption in our gut is even kind of like more like normal digestion. So that can become very problematic when the chronic stress causes a chronic change to our gut. We're way more sensitive. And now we start experiencing even normal digestion as disruption. And our symptoms can like basically kind of ebb and flow or last for years. And I see a lot of our patients coming in that condition. The good thing is we definitely have some ways to address that too. Next slide. So now let's talk about, we've talked about this connection between the gut and our symptoms and stress. We've talked about actually what is happening in the nervous system to create it. So now let's go to the next slide and talk about our treatments. So just to reiterate here about what kind of GI gut brain specialty is, it's targeted interventions. It's really GI symptom focused. It's integrated into a care team. I work with APPs, practitioners. I work with dietitians with specialized training in GI health, and we use evidence-based treatments. Again, it's not long-term traditional psychotherapy. It's not focused on trauma or general life stress. And it isn't redundant with like other mental health. For example, I work often with patients that come in and they're seeing a therapist, and I'll just want to find out kind of what they're doing very briefly so that I can make sure that anything that I'm doing is just going to be complementary to what they're doing. And it almost always is. So we do work with people that have a counselor because we're really doing the vast majority of times a very different type of treatment, but it can be very complementary. I want to talk about some of the treatments that we work with to improve GI symptoms. In general, we have what we call behavioral treatments, is what we often start with. So, for example, one type of evidence-based behavioral treatment for dealing with GI symptoms is diaphragmatic breathing. This is a very specific way of changing your breath. So let me talk for a minute about why that would matter. And we have to go back to that nervous system connection we talked about. The sympathetic nervous system response that disrupts the brain and gut and leads to more dysregulated gut has as a hallmark feature very quick and shallow breathing. The reason we breathe very quick and shallow in that fight or flight is because the body is trying to take in as much oxygen as possible so that we have the strength and endurance to survive an attack. So that makes a lot of sense for that situation. But when we don't need to run and fight and we don't want our gut to be disrupted, then one of the most powerful ways to intervene and to stop that fight or flight and reconnect our brain and our gut is to change the way we breathe. And we do it in a very particular way, and diaphragmatic breathing is that way. Diaphragmatic breathing does two things. It actually creates a deeper breath to counter that very shallow breath of fight or flight, and it slows our breath down to counter that rapid breathing in fight or flight. So in this technique, we are using the one thing that we have the most control over, which is our breath. We can decide how to breathe. So we use this behavioral breathing technique to actually grab a hold of the nervous system and bring ourselves out of that nervous system state, which allows us to reconnect our brain and our gut and actually manage and control symptoms in the moment. So if we have an onset of some abdominal pain or some other factor that comes up, diaphragmatic breathing can be used to really kind of lessen and control that symptom in that moment because we're literally kind of taking the nervous system out of it. We're reconnecting the brain and gut and letting that communication and connection to the vagus nerve really kind of treat and regulate our symptoms. We're just kind of changing what's going on in our body. So it's a really nice, powerful technique that I hope that everybody would kind of learn to utilize with the nervous system. I want to talk about a couple others though too, because I think we have a few minutes before I go to questions. Another treatment that we often use with good evidence base is what we call cognitive behavioral therapy, GI. And you might have heard of cognitive behavioral therapy in more general. It's a very good evidence-based treatment. Um, and the way that we work with this and what cognitive behavioral therapy is really it's looking at the way we think about our GI symptoms. So the thoughts that we have about GI symptoms, our level of concern or worry or fear can have a really significant impact on how our body feels. And I think we all kind of know this, right? There's a really common human type of thinking that we call kind of catastrophic thinking or worst case scenario. A lot of people experience this. If you do, you're not alone, right? Pretty much everybody does at times, where we start, maybe we have a symptom in our gut, we have some pain or some discomfort. And because of our experience, we start to think like, oh my gosh, this is going to get horrible. There's nothing I can do about this. That kind of thinking pattern, as you can remember, is just going to be seen as a threat. It's going to trigger our fight and flight nervous system, and our fight and flight nervous system is going to disconnect the brain gut connection. And that is going to have the effect of amplifying or exacerbating that discomfort in our stomach. So, as you can see, one of the things we target is looking at and trying to check our thoughts, examine our thoughts for a minute, try to bring them a little bit more into rational fact base. And that can be hard for us humans, but there are some really good specific strategies and skills to be able to control our thoughts about our GI so we can get a better handle of the situation and not let things get catastrophic, worst case scenario and escalate. So there's some really good strategies we work with our members on. That's kind of the cognitive strategies, and the breathing is more the behavioral. So that's a package that we often work with people on. One more here, because I think this is a um, really interesting treatment when it comes to gut specific, and there's a lot of evidence base for this. There is a treatment called gut-directed hypnotherapy. I don't know if you've heard of that. And it actually, we use it through an app. And what this therapy is, it is a kind of a type of guided meditation. It's a guided meditation practice where it follows through a very specific protocol where you do relaxation strategies, you do guided visualization strategies, and then you go through a set of kind of gut directed statements, which are just about your symptoms. You do this on a consistent basis. It's usually over a period of about 6 weeks. And this protocol is purpose built to help modify some of your fears and concerns and your thoughts about your gut. And it also specifically uses a lot of those relaxation strategies to spend more time in that gut connected parasympathetic rest and digest state. So it's a very specific protocol, has very good evidence base, especially for treating IBS. And it's something even that our members with IBD, kind of inflammatory bowel disease, they also can benefit often because IBS and IBD often come together. And IBS often is kind of overlapping on IBD. The sensitivity of the gut, that visceral hypersensitivity in our gut, that is what gut-directed hypnotherapy targets. So that's another treatment that we can work with and help facilitate people to have that experience and see some improvements. I think that's probably the ones that I'll go into for now. I'm looking at our time and I want to make sure I can get to the questions. I think I saw some other questions come in as I was talking. So I'd like someone to kind of help me grab those. Um, but I think basically that kind of wraps up this part. And maybe go to the next slide to finish this up. This is just, I guess, just to remind everybody, as Heather was saying earlier, we are in network. There's a code here that you could scan to learn more about Oshi. You can schedule your first appointment through this app. And always feel free to reach out to the Oshi team if you have any questions. My Oshi email address is here, along with Caitlin, who is running the slides and helping me today. So we would be happy to talk with you about our care. Again, I'm a gut brain specialist, and I think I described in a lot of detail what I do. But you're also at Oshi going to meet with first an APP, a practitioner who's going to look at your whole history of GI and make sure that you have all the care that you need, any labs or anything that's necessary. We also have dietitians that have specific expertise in GI health. And we work in really an integrated kind of whole person fashion so that we can make sure that we're taking care of not only how diet impacts gut, but as I described, how the nervous system and the brain gut connection impacts your symptoms. We put it all together, and our goal is to try to help all of our patients feel better as quickly as possible. So I'm wondering, I guess I should maybe go on to the questions. Would that be okay? Is that the next part of this?
Yes. And
Okay.
one of the questions that was posted in the chat is, are there diagnostic tests that could detect evidence of sustained cortisol elevation? For example, in people suspected of having CPTSD.
Well, that's an interesting question. I have to say that I'm not positive about I think that would be a fantastic question, to be fair, to ask our APPs, our providers to work with that. Um, I don't know of a specific test for that, but again, like I said, that would be something that our team would have expertise in, that it really isn't my specific expertise. So I wish I could speak to it, but I'd refer you on to our team, or I could, that question I can take and maybe get back to you for someone who would have a better idea of specifics there. I don't want to talk without kind of out of my expertise.
Perfect. If you could, and then when I send the link to everybody, the recording, I can
Sure.
always post the answer to that question in with the email.
Okay.
The next question is, out of curiosity, do you know if there is any evidence out there which connects long-term chronic stress to developing other chronic conditions or diseases in the gut?
Yeah, there's absolutely evidence for long-term chronic stress to affect not only GI symptoms and a whole variety, but to also, I think if you're getting this, to impact a lot of other health conditions. I hope this speaks to this question. When we talk about the nervous system, we're talking about the part of us that does all the complicated things in our body, right? Not only does it regulate digestion, it regulates other really life-sustaining, functions, heart rate and respiratory. And our nervous system, because of its regulatory, job, a lot of changes are going to happen, not only to the gut, but to other kind of chronic health symptoms when we're under stress or chronic stress. So there's absolutely a lot of evidence to talk about stress on cardiac and stress on kind of pulmonary health. So absolutely managing our stressors in a more consistent way, managing our nervous system response is going to have a direct effect on all these kind of chronic health symptoms and systems. So I hope that answered that piece.
Okay. There's another question. Have you read Gut by Julia Enders? I'm not sure if I'm saying that first name right. If so, thoughts on if you think it is a helpful book to read.
Oh, I can't speak specifically to that book. Sorry. Um, Gosh, there are so many books out there right now on GI and the connections with stress. There's some great podcasts also, which I could also give some links to when we send this information out that I think are great listens. And there's a lot of good books too. I don't know that one specifically. I think any book on kind of the gut, I hope would talk to the concept of the brain gut connection, the nervous system, how disruption, can create all kinds of imbalances leading to symptoms. So sorry, I can't speak directly to that book, but there's a lot of good information out there, and I'd be happy to provide some links, as like I said, to some podcasts and some other information when this gets sent out.
That would be great.
Perfect. There. Oh,
That's, are
yes,
there
go.
any other questions that anyone wants to post in the chat before he goes to the questions that were emailed to him?
Okay. Maybe I'll just start reading the ones that were emailed to me, give a little bit of an idea on these. One of them I think is there a direct connection between food and dementia? Which that's a great question, and that is an evolving science. I think what we can say right now is that, food doesn't cause dementia. It's not the direct cause of it. It's also not something that can guarantee to prevent it by just eating a particular way. I think that's pretty clear. But it's also become more clear with some growing evidence that food can impact your risk of dementia. And we find that in a lot of research. So kind of food, of course, can relate to the amount of inflammation. Inflammation also in the brain, right, is kind of part of that inflammatory process. Actually, inflammation in the body as a whole is also kind of something that seems to be linked with increased dementia risk. So, insulin resistance, all these factors come into play. So, I think we do believe that the food that we eat can have a significant impact on our risk. Um, I would love for our dietitians also at Oshi to speak to this more because that's their expertise. But I do know that, for example, the Mediterranean diet is a diet that is really rich, like in omega-3, in fiber and other things, and that has been linked and been looked at with kind of lowering dementia risk. So again, of course, not a direct cause, and I don't think that what you were saying with the question, and it isn't something that you can guarantee to prevent it, but we do see a lot of research talking about level of risk and food kind of contributing to that risk, either helping, either increasing or decreasing. Another question I got is, I think this one is, how can one ground themselves in the workplace in the middle of the busy day? I think that's a fantastic question that I talk to a lot of our patients about. Um, so, for example, when I was talking about our behavioral strategies at the end, I was talking about diaphragmatic breathing. And that is a strategy, as I said, that really grabs a hold of the nervous system. And no matter what's going on in our day, it helps us kind of come out of that fight or flight response, get back into that rest and digest response. And the reason we want to be in that rest and digest nervous system is that's the nervous system where our brain and our gut are most connected. We're getting better gut regulation, and it's going to help kind of be a symptom treat or preventative. So I think I think using that kind of behavioral technique, doing even around meals, for example, very common thing to do because meals, of course, is a time when we're forcing our body to do a lot of digestion, right? So that puts some pressure on it. It's a good time that we want to kind of make sure that the brain and the gut are connected. So a practice that a lot of people do is what's called kind of mindful eating. This really, in essence, can be just using some diaphragmatic breathing practice kind of during or right after a meal for a few minutes to make sure that we're getting good brain gut connection. That can be a great way to bring kind of that brain gut connection into the middle of a busy day. But you don't need to be eating. You can just, if you even have a chance while you're sitting at your desk or wherever, to take a few minutes of diaphragmatic breathing, these behavioral practices, I think, can be really powerful ways for us to reset our nervous system, bring ourselves back into that good rest and digest, gut healthy space. And that can kind of make sure that we don't just get stuck in that fight or flight and lead to more and more dysregulation. So great question. Um, Another related question is what self-care daily routine is best for mindfulness? Um, I was just thinking about this. I talk with a lot of our patients about this. One thought here is to get your best daily routine, I think it has to be a routine that is very personalized, just to be fair. What I find for myself, and of course for the patients that I work with, if I'm going to have success putting some kind of practice into my day to help myself be more connected and mindful, and I kind of think of that, to be fair, is just kind of connecting with the moment, paying attention to what's going on right in front of me, and kind of getting out of the crazy distracted state. That crazy distracted kind of multitasking state is a recipe for sympathetic nervous system, brain gut disconnect. So I think of mindfulness as a way to kind of settle my nervous system by just focusing on what is right in front of me. A lot of times I'll use my breath as that single point to kind of pay attention to. And that also has a really good effect of kind of managing directly my nervous system. But I think you want to sketch out your routine of your day and see if you could find one, two, or three times in that day that you could put in a little bit of that mindful practice of breathing. Um, some ideas I see from a lot of the people I work with, for example, they'll talk about right when they get up in the morning, they might have a few minutes before they kind of connect with everybody in the house. Their commute to work. If you're not working remotely, a lot of times a commute and in the car is a great place to take some time out for that. Um, we also talked about kind of lunchtime and meals is a great for that. The bedtime routine. I think you just have to make sure that you put it into your day and find what would work best for you. Another question was, what physical exercise would be recommended for a healthy gut? Um, I don't work too much with this, but I think there's some good recommendations here. And I do talk with patients about this. The usual recommendations are, first of all, you can do exercise that really focuses on brain gut health. So, for example, a lot of times things such as exercises, even stretching, yoga, Tai Chi, these are exercises and things that actually have kind of breathing along with it. So, we're really focusing on brain gut connection. Generally, it's suggested for good brain gut exercises, we're doing kind of low to moderate intensity, whether that be aerobic or stretching or core exercises. Usually, for the best brain gut connection, we're talking about more of the low to moderate and not the high intensity workouts for brain gut. Other things to remember, stay hydrated during the process. Hydration is going to be really important, of course, to your gut, to motility, and all those things. Um, and I guess that old saying of like, don't do strenuous exercise right after you eat, it definitely plays a role. When you eat, you're asking your gut to do a lot of work. And it's good not to put it under stress during that time. It's good to allow it to be connected with the brain. And a lot of times people find that a kind of a low intensity walk is a great part of exercise to really enhance that. I think one of the last ones, I think, Heather, and you can tell me if this, um, can stress cause Crohn's disease, or does it contribute because of the stress? So that was a great question. I think what we know is that stress does not cause Crohn's disease. Crohn's disease is an inflammatory bowel disease. And this is inflammation, right, in the intestines. we know that stress does not cause Crohn's, but I think as you indicated, or the person that asked this question, it absolutely can and often does trigger flares and symptoms for those with Crohn's. Um, and it can amplify existing symptoms. So a lot of times we are working with our members with Crohn's and we're teaching them a lot of these techniques to be able to manage the impact that stress has, because what we want to do is we want to reduce the frequency of their flares and symptoms. And even if we do have a little flare and symptom, we want to reduce the intensity of it. So I hope that speaks to the questions that were sent to me. Um, Heather, were there any others?
At this time, there are not. Did anybody have
Okay.
anyone else have any questions?
Well,
Nope.
if not, I'll say I really appreciate hopefully everyone's attention today. And my hope was to give you not only how stress and GI symptoms are connected, but also the model of exactly how they're connected, and also some very specific things to do to treat it and to make it better. So if you're interested in learning more, do not hesitate to reach out, connect with Oshi. It was a pleasure speaking with everyone today.
I greatly appreciate everybody joining us today. And just a reminder for those of you who are with Bexar County, they are partnered with Oshi, and Bexar County will be sending out an email to everybody as a reminder, and you can register that way as well. But again, thank you guys for joining us. We really appreciate it.